from the introduction, you can tell that I have a little bit of a background in trick, and actually I'm fairly passionate about this disease. When I left practice and started to pursue a master's, I was kind of in a situation of needing a project, and I kind of fell into a situation where they had some infected herds, and it led to a master's project, and it's just kind of one step after another. It followed through with additional research projects and continue. In fact, Dennis Hughes here has graciously allowed me to import some infected bulls this summer. And I promised him that I wouldn't just turn them loose or run them through the local sale barn when I was finished. But this disease, like I say, is something that I'm fairly passionate about, like Bud. And so I appreciate the opportunity to be here and spend a whole day talking about trick. And so I thank the folks responsible for getting me here. The goal for my presentation, I guess, as I see it, is really to start off the day by filling in any blanks, talking about the basics of the disease. And I know a lot of folks in this room have heard me talk about it because I see a lot of people from Nebraska, and they're probably tired of me talking about trick. But there's probably also some folks in here who maybe don't have a background that they fully understand or appreciate some of the nuances of this disease. So my goal is to kind of fill in those blanks and hopefully refresh your memory if you've forgotten some of these things. So very basically, Tritrichomonas foetus. It gets its name because it has 3 flagella. So tri, trick, hair. Highly contagious disease. It's assumed that somewhere between 80 and 90% of its cows exposed to trick-positive bulls become infected. In fact, they did a study with a group of virgin heifers, and 95% of those heifers were infected after exposure to the trick-positive bulls. So it is highly contagious. The thing that actually kind of makes it seem like we ought to be able to control this fairly easily is there's only venereal transmission. The only time it gets moved between herds and between animals is when there's breeding activity. So if we can avoid that between infected and uninfected animals, we ought to be able to stop the transmission. The other thing that really plays to our advantage is the fact that it's an obligate parasite of the bovine repro tract. It's very susceptible to heat. It's very susceptible to cold, drying, sunlight, all those things that do not allow it to live in the environment. It only lives inside the bovine repro tract. So you put those two things together, venereal transmission and an obligate parasite of the repro tract, why are we still having this discussion? I think to understand that, maybe we need to take a step back and take a look at the history of this disease just briefly. It's kind of interesting. They first time that trick appeared in any type of scientific literature was in 1888 in France. And they found it when they examined some cows that were having trouble with fertility issues. There wasn't a lot of activity in the literature until the 1920s, and by then it was spread around the world, even Japan. In the 1930s, there was a lot of work done in Germany on this disease. Unfortunately, it's hard to get a hold of those old German and Japanese articles, especially after World War II. But it didn't appear in the United States till 1932 in a group of Pennsylvania dairy cows. And that kind of set off an interest in trick for at least about a 10 to 15 year period of time. A couple guys by the name of Hammond and Bartlett did quite a bit of work. And in fact, the video showed how we collect samples, and it mentioned the fornix area. And the reason we sample at the fornix area is because something that was published by Hammond and Bartlett in 1943. So going back there, that's why we sample at the fornix area, and we'll talk about that just a little bit later. It wasn't until 1958 that trick was reported in any western herd, so it took that long for it to get out west and to actually be isolated from infertile animals. Which kind of brings us to this picture. My bet is everybody's probably seen this to us in some form. This is, as I remember it, what I was taught in veterinary school. That is the historic geographic range for trick, the Mountain West in Florida. And I guess the longer I'm working around trick and visiting with practitioners, especially folks that are a little bit older than I am and have a background in working with cattle, we say this is a traditional range, and yet Most veterinarians will say, yeah, trich's a problem. It pops up every 10 to 15 years in our area. People get excited about it, kind of dies down, goes away. And I would include the state of Nebraska in that. To be quite honest, we've been dealing with trich in Nebraska for at least 10 years. And so is that really the traditional range, or is Nebraska part of that traditional range? And I think the real question is, what isn't the traditional range of Nebraska or of trich? Talking with folks from the South, Alabama, and Georgia, certainly trich is there. Iowa recently, I guess recently within the last 18 months, has had some trich-positive herds. And according to somebody I visited with here recently, even Tennessee's found a couple of positive animals. So it seems like about the only place left are the New England states and the Midwest that don't have trich. So I think it's pretty safe to say that it is a nationwide problem. People frequently ask what the prevalence of trich is, and my answer is I have no idea. It's probably pretty low, even in more endemic areas. But I can assure you that if you or your neighbor have trich, prevalence doesn't matter. It's a big deal. And I'll show you why in just a second. So what happens in females? Females are exposed to an infected bull. The organism enters their reproductive tract. It does not interfere with conception, so at day 17 or approximately that time of gestation, they recognize that they're pregnant. The embryo goes ahead and develops. At some point, the organism and the immune response to that infection damages the embryo enough that the cow's going to go ahead and abort. Typically, that happens somewhere between 50 and 80 days. The cow's immune system will typically clear that infection. She returns to normal fertility. Depending on which references you read, somewhere between 2 and 5 months. Some people say up to 7 months. But they typically do return to normal fertility and don't have any more trich in their system. Notice I said typically. There are some unusual outcomes to this infection. Obviously, we can see pyometras. Also see late-term abortions. I visited with the Nebraska veterinarian, and the only really obvious clinical sign of trich in one of his clients' herd was late-term abortions. Pregnancy percentages were pretty good, but they saw late-term abortions fairly frequently, and the diagnostic lab would get trich out of those fetuses. So you can have that happen. A couple of other things that we'll talk about on the next slide, but persistently infected cows and chronically infected cows can also be a problem. But in reality, the big thing that we see with trich, the main clinical sign is reproductive failure, and that's open cows. You can see up to 40. In fact, again, visiting with a Nebraska veterinarian, he had a client that had 50% of his cows open after one breeding season, which is really why we're here today. If you have cows and 50% of your cows are open, trich is a pretty important disease to you. So there we have it. A little bit about carrier cows or cows that have prolonged infections. Post-breeding, there are reports of females being infected up to 22 months and 300 days. So the classic, they get infected, clear the infection within 7 months, doesn't always apply, and certainly some females will maintain that infection for a longer period of time. Also in the literature are the chronic infected cows that actually carry the infection through pregnancy. These cows produce a normal, live, healthy calf, and yet they can also provide a trich-positive sample from the reproductive tract. And that typically is, at least from what we know from the literature, usually those infections are cleared within 3, maybe 4 heat cycles after calving. But when you think about that and start putting the breeding season in with all that, if she's a late calving cow and she doesn't clear the infection for 60 or 80 days post-calving, she's back in the breeding pasture with the bull still infected. So how often does that happen? Certainly less than 1%, as near as we can tell. Hasn't been a lot of work done in this area. Most of our work focuses on the bull, but certainly keep in mind as we talk about managing this disease, how we manage the cows is probably going to be fairly important to whether or not we clear this disease out of a herd. The interesting thing is there's also reports where people have gone in, managed these infected cow herds, and had no evidence of chronic carriers in the herd. So the prevalence of that condition is a little bit uncertain, but certainly appears to be quite small. But it only takes one. So in the male, it's a totally different story. Like most venereal diseases, T. foetus doesn't cause any noticeable clinical signs in the male. No tissue invasion, no immune response. We believe that as bulls age, they develop crypts, which are microscopic folds in the surface of the penis and prepuce, and those crypts allow the trick to survive and maintain that infection in the bulls. Although, again, there is some evidence coming out of Dr. Lou Strickland, who's now at Tennessee, did his master's and took a look at this, and his conclusion was it was a little bit hard to say that crypts were a real thing and were contributing to this chronic infection in bulls. But certainly, it appears that bulls older than 3 years of age chronically carry this infection. Not to say that younger bulls can't. They seem to be more transiently infected. So no clinical signs. There is no treatment. So even though they don't really have any clinical signs, they get the short end of the stick with this disease because if they're positive, they go to town to slaughter, or they should. So testing, and we've had a really good video on this, so this is going to be a little bit redundant. You've already seen this. You need some type of media, a pipette, and a syringe. Pass the pipette up into the fornix area. Scrape it and get your sample. The interesting thing is when you go back and look at the literature, there is absolutely no evidence that shows that using a pipette is better than using the what's referred to in the literature as a wire brush. It's also called a tricamper. They have a plastic version of it, or any of the other techniques. No evidence, but it works in range conditions, in field conditions, and that's the system we've adopted. There may be better techniques, and I think Jeremy's going to talk a little bit more about that later, so I'm not going to go too far into that. But getting that sample collected correctly. Hammond and Bartlett said sample at the fornix. I haven't published it yet, but I finished a research project that would suggest that if you really want to find the highest number of trick, you need to sample the tip of the penis. For those of you that have done this, getting the tip of the penis collected with your pipette, it's not easy. And I also agree with comments that were made earlier. It's not just whether or not we're doing a good job of collecting the sample, it's what we do with that sample afterwards. So I'm going to throw this slide up. This slide came from the late Dr. Jim Kennedy, who operated the Rocky Ford Diagnostic Lab in Colorado. Dr. Kennedy was on my master's committee, and I learned a lot from him. And this was his slide. He loaned it to me, and so I continue to use it because I think it really goes to the heart of our discussion of trick diagnostics, and something that I hope you folks will keep in mind as we go through here. There are 3 opportunities for diagnostic errors. There's pre-analytical, all those things that happen, collecting the sample, how we handle the sample, whether or not we're collecting the right sample. I once talked to a veterinarian, and he said, now, do they need whole blood or serum to test for trick? Well, good luck with that. So collecting the proper sample. The analytical phase is what happens at the diagnostic lab. Whether or not their machines are calibrated correctly and whether or not they're following their protocols. And then post-analytical, reporting errors, transcription errors. And I would like to include in this, and I'm not going to go into this because it's about an hour-long discussion in itself, test interpretation. When we get a test positive bull, does that mean he's infected? How we interpret that result needs to go beyond just simply reading the lab report and saying, yep, he's positive, yep, he's negative. We really do have to use our brains and interpret the test results. Because, as it turns out, in the human literature, about 90% of the error comes from the pre-analytical and post-analytical phase. only about 10% of diagnostic errors actually happen in the diagnostic lab itself. And I suspect that it's pretty close to that in veterinary medicine as well. All right. So these are my kids back when they were young and cute. They're now 15 and 13. And quite honestly, there's a lot of days when they aren't really cute, and it'd be really tough to get both of them to smile at the same time. But back when they were young and cute, they used to go to daycare. Periodically, they'd come home and they'd say, well, one of their little friends got in trouble for saying the bad B word. And it was such a horrendous word that they wouldn't even tell me what it was. Even though I promised not to wash their mouth out with soap or anything like that, nope, they couldn't say it. It was so bad. So what does this have to do with Trick? Well, after 15 years of practice and almost 8 years in the academic world, I've come to realize that in veterinary medicine, when it comes to dealing with disease, we have a bad B word, and that bad B word is biosecurity. When people hear that, their brains shut down. They have visions of people running around in Tyvek suits, doing all kinds of sterilization and everything else. So hopefully, as I go through this today, I can change your impression of biosecurity. Although I'm not going to use that word, we're going to talk about herd health assurance, kind of like beef quality assurance, herd health assurance. At-risk herds. How do we manage at-risk herds? So what is an at-risk herd? I guess from my thinking, if your neighbor has Trick, you're at risk. If Trick has been in your general geographic location, I've been working with Dr. Lytle down in Arizona on a research project, and I've come to conclude that most of the state of Arizona is at risk. And I suspect there are several other states in a similar condition. It really does depend a lot on where you are and what your neighbors are doing. But how do we handle these at-risk or high-risk herds? I think, first of all, we need communication. I have veterinarians and producers here. That communication, basically, that represents an educational component. I think, myself, I frequently overestimate how much people know, how much they've heard. I encounter former clients, and they ask me what I'm doing, and I tell them, and I mention I do research on Trick, and they ask me what that is. And I'm thinking, you guys are pretty good cattle producers, and you never heard of Trick in Nebraska? And it surprises me. So educating producers, and in some cases educating veterinarians about this disease, is part of the communication process. And then producer-to-producer communication. Having people who have Trick inform their neighbors really helps control this disease. I worked with a herd in the Sand Hills of Nebraska. As soon as he found out he had Trick, he started calling his neighbors, letting them know. It makes sense to do that, because if he has Trick, it came from somewhere, and most likely it came from one of his neighbors. So why not tell them so that they have the opportunity to start testing and get their herd cleaned up too? The world's hardest thing to do, though, is to get somebody to tell their neighbor that they have a venereal disease in their cattle herd. So I do think that, notice it's at the top of the list, communication is really going to be vital to us actually getting a handle on this disease. Planned grazing, sometimes that's easier said than done, but certainly if you're up against a neighbor that has Trick, if you can avoid putting cows there during the breeding season, that obviously gives you the advantage of not having to worry about bulls crossing the fence and getting in with the cows, or vice versa. So planned grazing. Appropriate fencing. I guess appropriate fencing varies from producer to producer. My father-in-law has a neighbor who, I'm not sure, I think his idea of appropriate fencing is not cutting the cedar trees between him and us and just having a natural fence, but cows do push through those cedar trees. As it turns out in this picture, Fernando, they're standing across a 5-wire barbed wire fence from that heifer, and that kept him out of the pasture all summer. The amazing thing is, the summer before, though, there was a bull that got across that fence and didn't even break a wire. I'm not sure if he crawled under or went over, but sometimes the only way you're going to keep bulls out is the planned grazing. I do know, though, that a fella in central Nebraska ran about a half-mile electric fence in an attempt to keep his bulls and cows away from the neighbors. And in some cases, that may be what it takes to get the job done. So having appropriate fencing. Monitoring fences and cattle, and going back, and when commingling occurs, communicating with that neighbor so everybody's in the loop and knows what happened. And I have more than one example of folks that had dealt with trick and had later on, after they got it cleaned up in their herd, had a bull jump out with the neighbors, and instead of doing what most people do is run their bull back in, fix the fence, and call it good, they ran the bull home and put him in a lot and started testing for trick. And on 2 occasions, they found trick-positive bulls. Now, was he positive when he left the herd? Doesn't seem likely. More than likely, he picked up the infection when he went visiting the neighbors. So, monitoring fences and cattle and making sure you do something about it when that happens. Maintain a closed herd. That's the answer to everything. Obviously, if we could put a big shell over each herd, we'd never have any problems. That's not realistic. But there are some things we can do to at least make a good attempt at having a at least modified closed herd. One of those things is utilize artificial insemination. Done properly, that eliminates the transfer of the organism. Observe regulations. For those of you in the regulatory business, you probably appreciate that. I always tell folks, regulations are there to protect you, but they're the bare minimum in most cases. Just because it takes one PCR test to get a bull into the state of Nebraska doesn't mean you should only do one. There may be times when you probably ought to do more than one. So they're there to protect you. Observe the regulations. And I know Dr. Hughes has told me stories about people who chose not to follow the regulations and paid a pretty hefty price because they introduced trick into their herd. Purchase only virgin and pregnant replacements. Certainly that helps. It certainly reduces your risk of introducing the organism through your female purchases. Isolate and test herd additions. Again, that's kind of as a veterinarian, that's what I always tell people to do, and almost nobody does it. And yet, taking the opportunity to allow those animals to acclimate and to do some testing really can help you avoid some wrecks down the road. And again, isolate and test herd reintroductions, records. I work at the Great Plains Veterinary Educational Center. We're the ones that produce cow-calf 5 record system. So obviously records are important to us from a production standpoint, but they also are important from a disease management standpoint. And proper identification is part of records. If you have 121 black Angus bulls and 4 of them have a white number 4 ear tag, it's probably going to be hard to decide which one of those is positive when it does show up positive. So, having appropriate IDs is pretty important, and tracking where those animals are in the system as far as the ranch or the farm's grazing and breeding system is pretty important. And this is an example of that, how records can play a part in helping people detect the problem early and also deal with the problem. So this is a ranch up in Sand Hills in Nebraska, 1,500 head of cows. Their open percentages, 2004 and 5 and 2006, it was really dry, and they assumed that they had an increased number of open cows because it was dry. 2007 was a wet year. They had all kinds of extra hay, all kinds of extra grass, so that fall they didn't preg check. They got probably about 2/3 of the way through their calving season and realized were having a wreck. There were a lot of cows that were open or at least not looking pregnant, so they had the vet come in and preg check. 27% were open. At that point, they realized they had a problem. So they let their neighbor know, 3,000 head. How many of you think that guy had trick? Sure he does, because he's on the slide. If he didn't, I wouldn't have put him up there. It's a trick question. And my students know I always have trick questions. Sure he had trick. These are whole herd percentages. When herd B went back and took a look at their records, 8% were open in 2006. They had 12% open in 2007. And that was just in the management group that was exposed. They knew which management group had been on some public grazing. There had been some commingling with neighbors' cattle, and that group was the group where all the positive bulls came from. So records are important. The third herd I worked with, historically they had about 7% open. 2008, they had 14% open. This would have been a lot worse, except their vet talked them into testing the bulls before they went to breeding pastures. But they were in a hurry, so they kicked them out. It was over the 4th of July. It took them over a week to get the results. They got the results, they had positive bulls, so they gathered the positive bulls. Obviously, by then, they'd done some breeding and done some damage. The interesting thing is, when we broke those out by breeding groups, 2 groups had no infected bulls. You can see 8 and 9% open, and the other groups had a higher percentage. So in fact, if you look along the x-axis, percent of T. fetus infected bulls in each breeding group, the y-axis is the percent open cows, pretty much a linear relationship in this herd. So having records, being able to identify management groups that may be a problem group can give you keys to early signs of trick and certainly help you avoid a major disaster, the 40 to 50% open cows down the road. Surveillance testing, obviously, if you're an at-risk herd, testing is going to be important. And I'll say this now, and probably I'll repeat it later, mostly because I'll forget that I said it now, but be prepared when you start testing for positive results. Know what you're going to do when you get positive results. Even if you don't think trick's involved, you better have a plan for positive results, because you will get false positives. Low-risk herds. If you're in Ohio and your cows are surrounded by cornfields and bean fields and UAI, you're probably a pretty low-risk herd. There are obviously some things that you need to do to protect yourself, and a lot of these things overlap. Communication, monitor fences, maintain a closed herd, AI, regulations, purchase only virgin and pregnant replacements. Isolate and test herd reintroductions? Yeah, maybe. But again, if you're testing, you better be prepared for positive results. And how are you going to handle that? Records, all these are important. And again, surveillance testing. Maybe not that critical. Infected herds. So this is actually the herd that I worked with had 120 Angus bulls and 1 Hereford bull. Again, communication's important. Test and cull. And my answer to everybody's question is no, you cannot test one time in an infected herd and feel like you've got them all. I realize that running bulls through the chute is not fun, it's a challenge. But if you want to clear up a herd of trick, you better test more than one time. And this is my evidence based on the work we did in this ranch. You can take a look at this with culture. The first time through, and we tested every bull, positive or negative. They didn't leave the herd. All 121 bulls were tested 3 times. First time we found 8 with culture. Second time we found 2 new ones. Third time we found 1 more new one for a total of 11. First test efficiency, if you want to call it that, basically 8 divided by 11 is 0.73. Pretty good size confidence interval. So I don't know how accurate this 0.73 is. But the point is, we didn't find all the positives with 1 culture, right? So PCR is better, or we'd like to think so. If you take a look at that, yeah, real-time PCR found 9 out of 12 on the first test. And by the way, we took these samples, put it in 1 pouch, read them for 4 days for culture, and then we split them and sent half of the sample to 1 lab for PCR, real time, and the other half for gel PCR. And then in gel, we actually found 13 positive bulls. But again, only 8 the first time. Now, my point isn't to compare diagnostic tests. We don't have enough numbers to be real confident in that. My point is, 1 test is not adequate to detect all the positive bulls in an infected herd. The simple answer, and I had a producer tell me this in North Platte, Nebraska, quietly after I'd given a talk on trick, was he came up and said, yeah, I had trick, and he said, I didn't bother testing. I just got rid of all 37 bulls or whatever. Started over. Quite honestly, that is probably the best way to go. Don't worry about the test, just sell all the bulls. If you got 3 or 4 bulls, why mess around with testing them all 3 times? Sell them and start over. It makes sense. It's quick, sometimes painful, but certainly it is the quickest way to eliminate trick. Use artificial insemination if possible. Maintain a young bull battery. Obviously, they can be transiently infected. These young bulls, they're less likely to be persistently infected. Cow management. Cull all non-productive cows. So the quick way to get rid of trick in a herd, sell all the bulls and start over. Every cow that's open, every cow that aborts, every cow that has a calf die before the next breeding season leaves the farm directly to slaughter. So the only cows that are going out in the breeding pasture next year have a calf on their side. That's your best bet, short of selling all the cows. Best bet for ridding your herd of trick. There is the opportunity to maintain cows. If you have 50% of your cows open, it may not be financially feasible to sell all of them in 1 year. So you can establish clean and dirty herds. There's huge risk with that. We talked about carrier cows and persistently infected cows. If you're going to have a producer do something like this, they better have their ducks in a row. Make sure there's no commingling of these 2 groups. The potentially infected, which are the open, non-productive cows, need to be in an isolated area away from the neighbors, away from the producers producing cows, and managed as a separate and distinct herd. And they should never leave that infected group. So in a trick-infected herd, an open cow should be considered an infected cow. Again, records are important, and certainly surveillance testing is one of the things that's going to have to be ongoing. So just to wrap this up, it is my opinion that if more care was taken in the sale and purchase of barren cows and the purchase of bulls of breeding age, and if the farmers could be sufficiently educated to the unique opportunities for control that this disease offers, then its total elimination should be practicable in the quite near future. This fellow was from England in 1950. They pretty much eliminated trick from England. There are large parts of the world that have eliminated trick. Typically, they're more intensively managed, smaller herds, utilize a lot of AI. But certainly it's possible to eliminate trick from cattle populations. But it requires the use of the bad B word. Regardless of the testing and the sampling, it really does require good biosecurity. And if you have producers that are unwilling to do that, still want to eliminate trick, then this is my answer: buy sheep. You don't have trick with sheep.